COVID forum. This is our third such community forum. Unfortunately, we need to have another one tonight. My name's Terry Welsh. I'm the Chief Executive Officer of Mildura-based Public Hospital, and on behalf of a number of key partners, I extend a very warm welcome to you tonight. Tonight, we're streaming through many communities on Facebook. We know we're going through Robinvale, Oyen, out to Murrayville, down to Swan Hill and beyond, of course. And I welcome everyone here tonight for what's going to be, hopefully, a very informative session. It's an incredible time, a challenging time, and for many, there are a lot of unknowns. And tonight, with the expert panel we have with us, we hope to be able to answer many of those unknowns. We welcome your questions. We ask for sensible questions is all we ask. In particular, I'm delighted to welcome Jerome Weimer back to us again, our COVID commander for Victoria, and of course, Bruce Boland, who is the director of the Loddon Public Health Unit. I also acknowledge tonight with us is our Mayor of Mildura Rural City Council, Mr. Liam Wood, and other councillors with us tonight. I'd like to do acknowledgement to country. On behalf of all of us here, we would like to acknowledge the traditional owners through the Murray-Mallee region on whose land we work and live as First People of this nation. We pay our respects to elders past, present, and honour their culture. Tonight's a really important night for us, as I mentioned before, and I thank so many people streaming on Facebook and being with us live tonight. Please engage with us. We want to be able to answer your questions. Please note tonight is being recorded, so just take that advice on board with any comments you may have as well. We're going to have some presenters as we have before, and then we'll open the floor up for questions, and we will utilise the experts with us tonight. So without further ado, let me introduce Dr. Bruce Boland. He is the Director of the Loddon Mallee Public Health Unit, and he will provide us a current situation report for Mildura and the Northern Mallee. Bruce, welcome again and thank you.
Many thanks, Terry, and good evening, everyone. I'd also like to start by acknowledging the lands on which we're meeting today and acknowledging Aboriginal elders of the past, present and emerging. So in the Loddon Mallee over recent days, we've seen a similar pattern to what I'm sure Joan will go on to describe and that people would be aware of as the overall state situation. So a very rapid increase in cases, which we've got good evidence to suggest is primarily being, but not exclusively, but primarily being driven by Omicron, the new variant that everyone's heard so much about. To illustrate that, from the 3rd of this month, we went from 170 cases 2 days ago to on the 4th 274, and today several hundred more new cases. So that fits very much with what we're seeing statewide. Very rapid increase in cases. We have well over 700 active cases in the region. And as everyone is also aware, there are many challenges for our testing system at the moment, both for people to access rapid antigen tests and also to access PCR gold standard type tests as well. And a lot of the delays there we know are impacting the numbers, and we're almost certainly the reported numbers there are significantly lower than what's actually out there in the community as we speak. Happily, hopefully, many of those infections are either amongst people who are entirely asymptomatic or people who've got very mild to moderate illness. We haven't seen it translating in our region, happily yet, into significant additional numbers of hospitalizations, although the work of the hospitals in this space is, of course, exceptional and ramping up very, very considerably on the work around our COVID positive pathways. To add a little bit of context as well, definitely we're also seeing a consistent with what's happening statewide. Increasingly, almost all, well, not all, but the vast majority of cases that we're seeing are clustered within the 20 to 29-year-old age group. That's something we've seen consistently across the state and also in our region, and also a downtick. Particularly, we were getting many of our cases previously were amongst school-age young children and young people and their parents. That's really declined, and it's been replaced by a much higher proportion of those younger cohorts. With that, of course, we're seeing a very significant growth in the number of exposures, the number of outbreaks, particularly in sensitive settings such as residential aged care, which of course we are acutely aware of and work very closely with our partners across the region to try and address as rapidly as possible. And also in terms of contacts, and of course that's driving a huge amount of engagement with our testing. Obviously that's very challenging for everyone involved. be they waiting in the queues for long periods of time, or for the staff working out there in really high temperatures over the summer months here in our northern area, where temperatures are several degrees higher right the way through the summer period, of course, provoking a whole sequence of additional challenges. So just to conclude then, we know at this time our efforts are much less about counting the numbers and much more focused on dealing with the major outbreaks and exposures when they arise, and focusing on protecting our most vulnerable and protecting our vulnerable systems. That could be our health system and our other systems which enable the safe life and a good quality of life across our region, which of course continues along. But that means that we are pivoting our approach a lot, and we are asking much more of the community, which I'm sure Jerome will also go on to talk about, in terms of people and their actions. And with all of those challenges around testing, we are working very, very hard. The team are working around the clock to try and move this forward for us regionally. But we know that there are real challenges, and they will likely continue for several days. So one of the key messages, I guess, from me, from our public health unit team is, please do be patient with us. If you're symptomatic, please try and isolate at home. If you can't get a rapid antigen test, if you can't get into a PCR easily, please do isolate at home. And then my second key message for you would be, the best thing that we can do to keep ourselves safe is get vaccinated, and in particular, get those booster jabs as rapidly as we possibly can. And we're really motoring forward with that right now as we speak, and coming into the future weeks as we go through and really trying to accelerate our work across the region. So that's it from me. Thanks, Terry.
Bruce, thank you, and thank you for your ongoing leadership. It's just so much appreciated up this end, and really appreciate the work that you're doing. Jerome, welcome back. Jerome, of course, is a great friend of ours, been with us on many forums now, and is the COVID commander for Victoria. And in many ways, I'm sorry to have you back, Jerome. It means COVID's brewing, but great to have you with us again. Thanks for being here.
Good evening, Terry. Good evening, everybody. Great to be here. Thank you for the invitation, and can also start by acknowledging the traditions of the lands on which we're all gathering. In my case, I'm down in Wurundjeri country. I'm down in Melbourne. Look, it's with mixed feelings that we're back here around the Zoom call talking about COVID in our community, and it's a very rapidly changing picture. Really, over the last 3 weeks, I think just at the time that I know all of us were looking forward to easing into Christmas and the New Year. That's when we started to see a significant change in the way that Omicron, as a new variant, is coming into our community. And as Bruce has touched upon, it requires it's a very different beast that we're working with compared to the previous waves of COVID that we've seen. When we last all spoke together on this forum, I think about 3 months ago, Terry, 4 months ago from memory, we were dealing with Delta, which had what we thought were quite high cases then, significant attack rates, and some really complex community outbreaks that we're dealing with, particularly in the Mildura, Sunraysia area. And we saw some very significant and quite worrying hospitalization rates coming from that. Some people getting very seriously ill, and of course, some people sadly losing their lives. What we're now seeing with Omicron, and the response we did with Delta, the overwhelming and the amazing community response we saw both up in the Northwest and across the whole state, in fact, across the country, was that really aggressive vaccination drive, particularly over August, September, October, November, where everybody got out and got themselves vaccinated. And we've got some of the highest vaccination rates of any state, of any country, of any community, and phenomenally high rates, particularly up in the Mildura area, with I think we're like some kind of ridiculous 99% rate of people having the first dose of vaccine and second dose. So phenomenal performance. And that's how we dealt with Delta. That's why that highly vaccinated state by October, November allowed us to ease off the restrictions. And even then we were having the conversations about we were going to see fairly high numbers of cases in the tens in the community level, in the hundreds and thousands at a state level, continuing to circulate, predominantly amongst those who are unvaccinated. But that was a reasonably stable picture until about 3 weeks ago. What we've seen happen over the last 3 weeks has been the incursion of this rapidly moving Omicron variant, which has a far, and Bruce can speak to this better than I can, but a very, very high attack rates, highly infectious, and has a much greater ability to break through on vaccination protection compared to Delta. And what this means is, particularly as we start to get a bit further away from our second dose period, the longer ago we had the vaccine, the more vulnerable we are to catching Omicron and passing it on. So that rate of transmission has rapidly increased, and I'll show some charts in a moment. What we think we can see with Omicron is that it is less severe. And I think a lot of the public commentary, a lot of the media commentary, some even maybe from Canberra, is, well, it's a mild version, it's less severe, aka we don't need to worry about it. Well, we think that's true, and we all the signs around the world, given this thing's only been with us for about 5 or 6 weeks in the world, are that it appears to be less severe. It appears to put fewer people into hospital and fewer people into ICU, but it is still putting people into hospital. And in Victoria, our hospitalisation numbers are starting to increase quite significantly, and they're really starting to increase in New South Wales. So I don't want us to feel that, you know, this is okay, it's not really a drama, it's just another flu. This is quite significantly bad for people who get it, and it can have real complications. So we're still doing everything we can to protect ourselves, to reduce transmission, and to get into those booster vaccinations. I might just, either Dan or Paul, if you could just share the slides that we've got, and I'll go through these very quickly, but I think it will tell the story of where we've been over the last few weeks and what we can all do as a community to deal with this. Ben, actually, sorry, Ben, could you share these slides? I think you've got them. Dan's not allowed to share them.
Jerome, I've just got a message. Apologies, I can't actually share those slides.
Okay, all right, that's fine. Don't worry, that's not a drama. Don't worry about it. In terms of the picture I was going to show you, so in the first 3 days of actually in the last day, so today in Victoria we had 17,000 new cases, 17,636. In a single day, therefore, we had almost the same number of cases as we had across the state in the entire year of 2020. So if you think back, you know, a year and a half to this first wave and that horrible second wave, we saw 20,000 cases in the entire state over the entire year. We've just had almost that number in a single day, and I suspect tomorrow will be a similar number. That is the kind of the rate of numbers that we're now talking about. We have at the moment in the state probably around 50, 60,000 people who are active with COVID that we know about. That means we know we're underreporting those numbers because we're seeing far more people now struggling to access the PCR system, and we feel, yeah, there's always a bit of a multiple. So I suspect at the moment that probably around 2% of Victorians are currently COVID positive, and that number is probably an underestimate in itself. It means that in terms of our day-to-day movements, we're far more likely to be encountering people who are COVID positive. Back in the day, we were worried about exposure sites. I remember the 9 or 10 exposure sites we had in Mildura, and we'd be very worried about who went to which pizza restaurant. We're now in a world where, frankly, if 2 out of 100 of us are COVID positive, in our normal day-to-day encounters, in the bakery, in the supermarket, and at the pub, we are likely to be socializing and around people who may have COVID and may not be aware of that. So our risk of exposure is far greater. What we're also seeing is that 60% of our cases are in people under the age of 40. It's the young, it's the age between 20 and 40, slightly younger than me, I'm afraid, people who are out and about socially, particularly over the Christmas and New Year period. That's really driven this very explosive increase in numbers, the same as we're seeing in New South Wales. What we're also now seeing is it's particularly, and if I look at our friends in New South Wales, where Omicron has been active for a little bit longer, you know, they're at 35,000 cases today, but the daily case numbers that they produce and we produce are increasingly less accurate because there'll be far more people not getting tested, and the testing systems are really under a lot of pressure. And anybody who's tried to get a test recently will know the queues are really quite long. We're looking at around sort of 2 to 3 hour waiting times now. That's a really big ask for a lot of people. So those case numbers we expect will continue to increase. We're expecting those case numbers to continue to rise all of January, all the way into the back end of February. This is a really, really significant challenge for our state. What Bruce and I are particularly focused on is how do we reduce the rate of spread and how do we minimize the hospitalization numbers. The thing that we can all do as a community, and the single most important thing we can do to protect ourselves, is make sure we get our vaccine third dose, our booster dose, immediately as soon as we can, 4 months after our second dose. So if you finished your vaccination last year before September, you can come and get your third dose today. And we're doing vaccinations at the Kiarivu Barracks up in Mildura. You can go to your GP, you can go to your pharmacy. Would really urge you to go and get that done now. So if you had your second dose before September, or in fact before the 5th of September, you can get it done, or you can book online at our clinics, or you can go to your GP or your pharmacy. We know that the booster doses have a massive impact in reducing your risk of getting Omicron, because Omicron is good at breaking through when the dose was when it's about 4 or 5 months out. We need to recharge our vaccine status, and all of us need to get on and make that happen. So most important thing you can take away from this conversation, please get that done. It'll keep you, it'll restore your protection. It'll keep you out of hospital. It will reduce the chances of spreading it on to other people. The second thing we really ask you to do is we're all trying to get used to using rapid antigen tests. I know they're like hen's teeth at the moment. It's hard to get the numbers we need. We are seeing some suppliers coming into our state now. We've ordered 44 million of them. I'm expecting more deliveries this week and next week. We will start today. We started making them available in a handful of our testing centres, not the one in Mildura yet, but that will be happening soon, just to test out how we're going to do this. But increasingly, you will see rapid antigen tests being used by both our state testing centres, particularly for those of us who are not symptomatic, but also they will become more available within our retail stores and pharmacists. We're all going to have to get used to using these, and we'll talk over the coming days about a distribution network that we in the state will run. Not only if we've got symptoms or if we think we've been exposed, but if we're going to go and visit our mum in an aged care facility, if we're going to go out to a big night out, I've got to go sadly to a funeral tomorrow, I'll be using a rapid antigen test before that, because any of those large gatherings, we do not want to be sparking off a whole bunch of other people. So rapid antigen tests are there not only to protect yourself, but also protect others around you. As of now, if you're turning positive on a rapid antigen test, you don't need to get a PCR. We're going to treat you as a positive case. We want you to isolate for 7 days and do all those other things that you would normally do. And you can still get access to the various incentive payments and support payments and services as you would with a positive PCR test. And we can discuss that in the questions. What I'm also really keen to do now is to make sure that we're also ready to isolate. So the chances are that all of us at some point are going to run into Omicron. The chances are all of us might pick up this infection at some point, particularly if we haven't got our booster dose. So just make sure you know what you need to do to get to isolate safely. If you're living alone, now's a good time to make sure you've got some beans in the pantry, you've got some bread in the kitchen, you've got the basic essentials of life just to make sure you can keep going. And you've kind of got your friendship networks up to date to make sure if someone needs to drop you in some milk or some other bits and pieces, they can do that for you. But having that isolation plan, it's like a bushfire plan. We're all going to have to get a little bit more self-reliant about managing those kind of issues if we do turn positive, and we want to make sure we can isolate safely. And above all, keep a close eye on your symptoms. If you feel you're getting crook, please, if you can get access to a test, please do so. If you can't get access to a test, then please just isolate and let your GP know. Use the nurse on call service. If it's obviously really bad, by all means, clearly go to the hospital. But we'd really like you to get proactive at an early stage. If you've got any concerns about your health, let your primary care health provider know that you're starting to suffer, and they'll put you in contact with people who can support you, and above all, support you in the home. Finally, I know we're all done with masks. We don't want to do it. The good news is Omicron spreads a lot less likely to spread when you're outside. So look, as much as we can, the advantage we've got here in Australia, there's many advantages being in Australia. One of the many advantages is we can be outside in the summer and just make use of that far lower risk environment. So if we're meeting family, if we're meeting friends, please do it outside, and let's avoid those indoor spaces at this time. This will, I think, blow through pretty quickly. It's going to be a pretty fast and intense kind of bushfire type experience. It's going to blow through pretty fast. We're really there to make sure we can do what we can to support you to come through it over the days ahead. Terry, with that, I'll be delighted to be part of the question and answer discussion.
Jerome, thank you. Just fantastic to have you here, and we'll come back to you in a second with a number of questions that have come through already. I'm delighted to welcome Dr. Kane Treble. Kane is our Clinical Director here at Mildura-based Public Hospital of our Hospital in the Home program. Just going to spend a couple of minutes explaining how we're going to work through a program to manage what is going to be such a high volume of patients who need care and support at home. Kane, welcome and congratulations to you on a great job.
Thanks very much. And a big thanks to all involved, both in tonight's webinar, and a big shout out as well to the hard work from the home monitoring team. So we've been involved in the outbreak since the very start, and it's been an absolute pleasure to look after the hundreds of patients that have already gone through our program. But as has been made obvious tonight, case numbers are climbing, and we are seeing some delays in results returning from labs, and even some brief delays in those results being forwarded through from the public health units. If you have recently received a positive result and are yet to hear from us, hold tight. We'll be with you shortly. We've made thousands of welfare calls, provided hundreds of information packs and pulse oximeters, but I wanted to talk tonight about the SMS Self-Monitoring Program. In a nutshell, people who receive a positive result via SMS will now be sent a follow-up SMS directing them to fill out a brief survey. Admittedly, the link isn't that obvious right now, and so if you do get one of the SMSs with a link through about more information, click through, fill out that survey. The results of this survey will direct you through the option of self-monitoring via daily SMS messages or through the standard phone calls, which we want to try and keep for the higher risk patients. Now, we are seeing increased numbers of Omicron in the region, and so we would prefer, if appropriate, for you to perform the self-reporting and to try and reserve some of those phone calls for those at high risk. It will be harder for all health services across Australia to manage these individual phone calls, and so your help is appreciated where it's safe and appropriate to do so. If you do have any doubt or concern, by all means, opt for the phone calls. Talk to our staff. Many patients actually begin on phone calls and then when recovering, move across to the SMS self-reporting. So we're happy to work with whatever's best and most importantly, safest for you and your family. So thanks for your time, your patience. Remember, as numbers surge, the best protection, as has already been mentioned, is to complete your 3-dose vaccine schedule. Keep your hands clean, wear your masks when inside, and as has already been mentioned, try and keep everything outdoors. Stay well, stay safe, and thanks.
Thanks, Kane. Congratulations again on the work you're doing. We've got a number of questions that have come through. I'm going to try and break them into 2 sections now. One, some community-specific questions, and then we'll move into some industry-based questions and obviously the effect on business, which has come through. So, Jerome, a question that has flown through, as you'd appreciate. Let's get the elephant out of the room. Are we going back into lockdown?
No, nobody wants to go back to lockdown, Bruce, and I'm not detecting any sense of that direction at the moment. And look, I'll put it this way, the balance we have to strike. Lockdown is great in terms of minimizing and reducing people's contacts. I think we've all been through enough experiences of that in the last 18 months that we really want to avoid having to go down there again. The only way, however, that we will if we're not going to use lockdown is it then comes down to all of us individually doing the right things and doing what we can to minimize and slow down that rate of transmission. So it is a bit of a day-to-day game at the moment, but there's no axe hanging out there. We saw a really strong uptake yesterday in terms of 3rd dose vaccinations. That was a really encouraging day. We'll see if we continue to see that really good progress over the next few weeks. If we can start to see those hospitalisation numbers start to come down, recognizing we've got 591 Victorians in hospital today. That's up about 200 in the space of the last 8 or 9 days. If those numbers don't start to taper off, then we will have real problems and real pressures in our healthcare system. So it is lockdown is an absolute desperate last resort. I think we've got a number of things we can all still do before we have to get to those kind of horrific decisions, and there's no intention to go and do that.
Great news, thank you. A range of questions around boosters have come through, Jerome, so I might try and put them in some sort of, and we'll canvass them in one question. One is availability of boosters. Second one is if someone, is a specific question, if they've had COVID, how long do they have to wait to have their booster? 2 questions that have come through.
Right. All right. I'm going to handball the second one to Bruce because he's actually got some clear expertise. I always get that question wrong. In terms of availability of boosters, we have shed loads of Pfizer and Moderna available for booster doses. There is no shortage of supply in the state of booster doses, so that is not a problem. And we've got literally hundreds of workers in our vaccination clinics and primary care and pharmacies. We've put a series of grants in place to encourage pharmacies and GPs to run clinics in early January, so we can kind of get on with this. So there is a lot of capacity out there to go and do it. We just need people to come forward and make it happen. Today, I've got around 2 million Victorians eligible for their 3rd dose. Around 650,000 people have so far done it. So we've got probably 1.2, 1.3 million people who could be getting on with it. And if you're coming up close, if you had your second dose vaccine in September or even October, start making plans about when you're going to get your booster, because you're going to want that protection as these numbers start to rise. Bruce, on the advice around those who've had COVID and booster dose timing?
Yeah, so it basically, in essence, ironically enough, the best way to get a really strong immune response, well, the safest way to get an immune response is to get a vaccination first before you encounter COVID. Really, it's just a question of when someone's going to encounter COVID, and the safest way to do that is to get vaccinated. If, however, someone has been exposed and then gets vaccinated, they can mount a very strong response. And I'm afraid I don't have to hand the exact, the cutoffs there actually, Jerome, in terms of when the exposure date is. But you could get that advice from you, certainly from if you contacted the vaccination centre or from your general practitioner. But I think there's no real reason, once someone is fully recovered from COVID, and many of those infections, of course, are in people who are asymptomatic, there's no scientific reason not to get rapidly vaccinated. But I mean, hopefully, pretty much everyone in our region, or a very large swathe of people in our region who are eligible, have already had their first dose. So if they do get an exposure, I don't think that means that they will be guaranteed to become infected to a level which should delay their vaccination at all. And the safest thing, as ever, is to check in with your usual medical provider in terms of getting advice about what's right for you, and the choices, particularly when it comes to your boosters as well. There are lots of different choices now. Do you go for Pfizer? Do you go for Moderna? Whichever. It's worthwhile connecting to your clinician. That's what they're expert in, and they'll be able to give you that targeted advice, which is fitted to your personal circumstances.
Thanks, Bruce. It's one we've covered off before, Jerome, around exposure sites and hotspots. Do you just again want to explain why we've moved from there, please?
Yeah, look, Terry, I sometimes look back fondly on the times, from about 3 or 4 months ago when we had COVID at a level whereby we could track the individual cases in our community and where they'd been, and do that amazing work that Bruce's team especially did around contact tracing cases and really putting those fires out. I remember the rings of rings we used to do to try down those close contacts. What we found with Omicron is we started getting into the space with Delta. Delta already moves pretty quick. Omicron moves at lightning speed. And look, you don't need to take my word for it. Look at the case rates in the UK. Look at the case rates in New South Wales. Or look at the case rates that they had briefly in South Africa. I mean, UK, especially in New South Wales, they've been battle hardened in the same way as we have here in Victoria. And those numbers are just shooting off the scale. And those traditional systems and ways of working just can't cope with the sheer speed and ferocity with which Omicron moves to the community. So I go back to the point earlier, we know that through our if I just take the cases coming out of our PCR testing system, we've got over 50,000 cases now in the community, positive COVID cases. The real number will be more like 100,000, possibly even more than that. The implications of that is that the sheer number of positive people moving around during their infectious period, and the fact that we're all open at the moment, so all of our settings are open, is that we are all circulating, or very high risk of circulation of so many positive cases in our community, both in regional Victoria as well as in the metro area. So this is not really we're seeing a very similar caseload penetration, very similar rate of cases across most of Victoria. So at this point, there's actually no value in me listing just about every hospo venue in the state and saying there's been a positive case there in the last 7 days, you should watch out. There is no benefit in me listing every supermarket, because actually there is nowhere else for people to go, and it will just overwhelm everybody individually, as well as everyone's ability to kind of capture all that information and to feed it back. Can I just say, though, we are still doing a really aggressive focused job of protecting and putting our public health measures into those really vulnerable settings. There's a huge amount of work going into our aged care settings to protect and to minimize COVID coming into those places, and tracing it through when it comes into those very vulnerable environments. Similar in our hospital settings, speaking with hospital workforces. So we do have some settings where we are still taking a very forensic approach, but we can't afford to do that for the community as a whole. Finally, what I would say as a member, as a citizen, as an individual, when I go out and want to buy a coffee or buy some bread, I'm just very mindful that I'm essentially interacting with people who are likely to be COVID positive. I just don't know who they are. So wearing a mask when I'm indoors is something I'm starting to do pretty religiously. Being distant and you know, managing my engagement with my friends and loved ones is now something I'm afraid I'm going to have to do. And I've got to, you know, I'm using my RAT tests quite assiduously when I go into those high risk environments.
Thanks, Jerome. Now, a question has been directed to the hospital that I'll ask Andy Floyd, our pandemic response lead, to answer. Welcome, Andy. It's about pressure on our emergency department, what we're seeing and sensing and what we're expecting in the coming days. I'll throw to you, Andy. Thank you.
Thanks, Terry. Yes, look, we are already seeing increased demand on our emergency department, and we expect that that will continue to rise. And of course, with increasing demand, we have got lots of processes in place to make sure that we are screening and testing patients appropriately and keeping our staff and the patients that are in the emergency department safe, making sure that we've got all of those right screening processes and things in place. Staff are all wearing PPE appropriately, so there is no risk of transmission there. So it's really important for people to understand. Sometimes it feels like things are moving a little bit slower in that emergency department, but it is because of that increased demand and the processes that we have in place for that. So we just ask that people are patient. If you are well enough to see your GP or access a service like GP Online, one of the nurse call systems, we would ask that you do that and keep the emergency department for emergencies. But of course, if it is an emergency, please come and seek medical help with us.
Thanks, Andy. Appreciate that. Ben, you've been monitoring Facebook. Any themes coming through you want to raise for us?
Thanks, Terry. There are a few coming through. What plans are there for non-vaccinated children when they go back to school?
Jerome, thanks.
Yep, great question, Ben. Thank you. Number one, 5 to 11 child vaccination opens up on Monday, and if we're for all those parents of younger children, please consider and make that a priority. We opened up the state booking systems for 5 to 11s this afternoon at 1 o'clock, and we've already had 7,500 bookings in the first few hours. So we are seeing people coming through. Those state clinics and GPs and pharmacies will be able to provide a pediatric version of Pfizer for 5 to 11-year-olds. Really important work. Look, we had a conversation today, actually at national level, around arrangements for schools in term one, and I think, to be honest, at the moment it's a bit too early to say what that's going to look like. I think at the moment, based on the case numbers we expect to see, there will be daily numbers, again, as we're seeing today, tens of thousands of daily cases circulating in our community. There'll be a lot of COVID positive people out there as the schools open up again. I think we've all got a general commitment to making sure schools can open and that kids can have an as normal academic year, given the real devastation that they've experienced over the last couple of years. Quite how that's going to work and what it's going to look like, we just don't know at this point. We're obviously exploring how we use rapid antigen testing in that environment, what that kind of frequency cadence would be, but that's work that we're still working through with our education teams and our medical teams, and we'll share that information as soon as we have it.
Thanks, Jerome. Some questions coming through, and we've had them during the day as well, around close contact and the definition of such. Can you just again, and this will help certainly in our retail and hospo space around the close contact, please, and their requirements to furlough?
Yep. Okay. And this becomes, I think it's some really straightforward rules we all need to get used to now. So, look, let's start with if I'm a positive case, I've got a duty under the Health Act. It's my responsibility to tell my employer or my education, my school, wherever I attend most of my time. I have to tell my household and inform them that I'm positive, and I have to inform people I've had social contact with over the infectious period, over the last few days. That's directions and advice that you'll be given if you turn positive. That's the information we provide you with. Really important that individual does that, because if that individual doesn't let their friends and family and workplace know, then actually those people are at far greater risk of contracting COVID without being aware of it. That's number one. It's a duty they have. If you're a positive case, you have to isolate for 7 days from the point of your test, and then you can exit after 7 days. And that period recently came down to from 10 days down to 7 days. So I'm a positive case. I have to let people know, and I have to isolate for 7 days. If I live with a positive case, if they're my partner or my child or my parent, I have to isolate with them for 7 days. I have to quarantine with them for 7 days. We would like you to get a test, and I would encourage particularly use of rat testing for this. If you develop symptoms, we'd like you to get a test to confirm that result, ideally a PCR test. But the most important thing you can do if you live with a case in your home is to quarantine for that 7-day period. You are quite likely to catch COVID from them. I've got many friends now in the last week in particular, where particularly their 25-year-olds have been out and about partying and they've now contracted COVID. I think we'll all start to see that in our social circles. You're very likely to get COVID. So if you're a case, isolate for 7 days and tell everybody. If you live with a case, quarantine for 7 days with them and keep an eye on your symptoms and get tested along the way if you've access to the testing system. If you are a workplace contact, so if you're an employer, so if I work for Terry and I tell Terry I was positive in Mildura-based hospital, Terry's got a duty to tell other people at work and say, Jerome was wandering around, he was positive, that's annoying. And there'll be arrangements in place for each employer who says, I've got a pretty good idea who that person had contact with, depending on how the organization's structured. The employer has to let people know, dudes, you're a workplace contact. You do not need to quarantine as a workplace contact, but you have to keep a very close eye on your symptoms. And we'd encourage you to get tested and to use rapid antigen tests to do so. If you can't keep hold of them, then again, monitor your symptoms very closely. Again, depending on the nature of the contact at work, you may be very likely to catch COVID or a little bit likely. So that's what employers will let you know. You've got to use that advice and really focus on your symptoms. If your friends let you know that they're a positive case and that you saw them in the pub for a few hours, or you, whatever you did, you went for a bike ride together, again, watch your symptoms very closely. You do not need to quarantine, but you need to be very mindful that you might have caught COVID from your friend. We'd encourage you to use a rapid antigen test if you can get hold of them. If you get symptoms, go and get a PCR test. If you get symptoms and you can't access a test, then you should presume you've got COVID and start that isolation period. I hope that's clear, Terry. You're on mute, Terry.
Yeah, I'm on mute. I had to do it at some point. Thanks, Jerome. We've had some examples in town whereby some restaurants and hospitality facilities have shut through a bit of that confusion. You know, someone may have been in their facility for 2 hours dining and left. Are you able to cover that off in some more detail about how they manage that, please?
Absolutely. So look, if you're running a restaurant or one of the great cafes in Mildura, then look, if you're aware that a customer was in your establishment and they were positive, you do not need to close. I would urge you to make sure your staff are aware of that. Your staff should be wearing masks anyway. In fact, you know, that's why the mask rule is so important. If your staff are wearing masks properly, the risks of them contracting it are far, far lower. You should make sure your staff are aware that there was an exposure, that there's a positive case has been around. You should keep an eye on their symptoms. If you're able to get hold of rapid antigen tests, I would encourage you to use them for your staff for a few days, just to make sure they're not picking up symptoms. But you do not need to close. Again, you do not need to let your other customers know, given again the prevalence we're seeing of COVID in our community. But the reliance we're putting on that is really the COVID safe measures you've got. So if you're cleaning regularly, you're wearing masks properly, and you're doing all those other things, then the risk is relatively low. Not zero, but relatively low.
Thanks, Jerome. A couple of questions here, some practical questions. I'll go to you, Jerome, then I'll come to you, Dr. Treble. Should we still be checking in with QR codes if there is no longer contact tracing? Yeah,
so there is still contact tracing, Terry, but it's a fair question. We're still identifying particular venues and occasions where we're seeing really big clusters, and we've seen this in the last 10 days in particular with some nightclubs and some hospital establishments where we've seen an extraordinary number of cases coming out. So the QR codes have been invaluable in helping to establish that and to make those connections with people, to link those cases together. We can't link cases if we don't know who was there. So the QR codes have been hugely powerful. We will continue to use them to get messaging out to key people. It's a fair call to say we're not doing as much of it as we used to. But again, we're expecting this wave to flash through pretty quickly. There will be life on the other side, and we want to ensure that people continue to use those good behaviors. We're also, of course, aware that for many of us, the QR code system is also the way we demonstrate our vaccination status. So it has a double benefit in that regard. So please keep using it. as was publicised earlier this week or last week. We're very straight. We do not share that QR code data with anybody. It doesn't go anywhere else, and it certainly won't. So please keep using it. It will be invaluable from time to time.
Yeah, thanks, Jerome. We won't cross over any further into that discussion tonight. Dr. Treble, can you just outline, I hope we know this question, we might not know yet, how is home monitoring arranged if you have a positive RAT test, so rapid antigen test?
Yes, excellent question, and it's a bit of an evolving space. So there will be both phone and online portals in which you can register your positive RAT results, and they'll be forwarded through onto the Trevi database, which is kind of the big database that all these results get sent through. From there, they're allocated out to the regions and then through to the individual monitoring programs, as if they were just another result put through from a lab. So watch for more information coming out on this, and there'll be multiple ways to get that information through.
Thanks, Kane. I knew you'd have an answer to that. Very organised man. A long question here, Jerome, then I'm going to come to a couple more industry ones. The Prime Minister has said this afternoon that a PCR test is no longer needed if a positive RAT test is returned. This is likely to lead to thousands of positive cases unknown to the government. Is this situation expected, and will there be an expectation that DHS is informed of positive RAT tests? A long question.
Yeah, a long question and a good question, and actually Kane went to the answer, but I'll just underscore it.
Yep.
So we expect there are some. The Minister for Health is considering a number of public health recommendations at this very point in time. We're expecting him to make some announcements tomorrow around what his decisions will be. One of those issues that we think is likely to land is that there will be that if you have a positive RAT test, you will be required by law to report that to the Department of Health. As Kane has said, there will be an online platform that we'll open up in the coming days that will allow you to do just that. The importance of that, it's a really important thing because it allows you with a positive RAT to say, I think I've got COVID, here's my positive RAT result, and to provide us with some basic biographic details. You will then be treated as any other positive case through a PCR test. So you will be triaged in terms of your symptoms and your medical history. You'll get access to clinical support to guide you through that COVID isolation period, and to make sure that if your symptoms get worse, you can get speedy access to medical help. It also will mean you can access the Commonwealth pandemic isolation payments, because it'll give you a unique identifier number to say you're isolated with COVID, and therefore you need to access the relief payments that you're entitled to. So it'll do all those things. It'll be a relatively simple process. I went through the launch of it earlier today. It looks like a very good product, and we're very enthusiastic about launching it in the next day or two.
That sounds fantastic. Dr. Treble, I might come to you to give Jerome a break there about a clinical question, really, about symptoms and when do symptoms show if someone's had an exposure to any of the strains, please.
Yep, no worries, and ignore my dogs in the background, sorry. For Omicron, seems to be about 3 days is about average between exposure and development of symptoms. Again, thankfully, symptoms tend to be milder, which is also reason, though, please don't say it's just my usual cough, my usual sinus. If there's any symptoms at all, treat them as suspicious and just get a test done, be that rapid antigen or PCR, whatever you can get your hands on. It is a little bit different with Delta, which is a little bit longer, perhaps, maybe more around the 4 or 5 days mark, depending. But again, it just comes back to if you feel like you have symptoms, get tested.
Thanks, Dr. Treble. A few questions here now. Bruce, I'll come to you. It's an interesting question. What is our positive case level per 1,000 people? Obviously, there's a measure of that. Is this showing that we're high or an exposure there?
Yeah, look, I think Jerome will correct me if I'm wrong. This is changing very rapidly statewide. We don't collect this data on a day-by-day basis for our region, and also much of the results we're looking at are in the rearview mirror to some extent, because we're still processing results, particularly regionally. It does take a while as just geography comes into it in terms of getting those results back in a timely way. But there has been a really significant uptick statewide and across regional areas. Going up from a couple of weeks ago, we were seeing fairly consistently somewhere between 1.5% to 2%, 2.5% maybe, particularly in our region and across the state. That's really rapidly increased, and it will be changing as we speak, I'm sure. A lot of that isn't just about the rate in community, it's also about availability and the impact of availability of testing. But I think currently it's standing at around 20%, certainly for the metropolitan areas. We would be seeing it at a lower rate for regional areas currently because we've got an overall lower case rate, but that is a pretty significant growth. And it definitely indicates, it's indicative of the fact that there is probably a significantly larger number of people in the community who we're not getting to yet, who haven't been tested yet. And obviously that's such a big effort for why we're pushing into use of rapid antigen tests and PCR as much as we possibly can. But mostly this is about the fact that there's a wave happening. Happily, it's a wave which isn't one of those ones that's going to land on your head and completely crash you out, hopefully. Hopefully, it's a nice big fat wave that most of us can ride out, but it is a huge wave. And it just means that our testing system is struggling to cope with those numbers. And we know there's a lot more people out there than we're currently connecting to. And hence, the big emphasis on trying to get the supports right the way across the system, preserve our system, prevent particularly transmission into those really high risk settings. But Jerome can correct me if I'm wrong on the overall statewide picture.
Thanks, Bruce. I never picked you as a surfer, but great feedback. Jerome, a practical question that's come from Councillor Milne. Welcome to Councillor Milne tonight. At what point should council or a number should council activate their emergency response?
Yeah, great question, Councillor. And again, thank you for raising that point. Can I thank actually our partners in the city of Mildura and other local authorities. I think they've just been fantastic to work with over many months now. Look, there is a whole heap of planning going on across emergency management Victoria, all the state agencies, and with local government partners around contingency planning for when case numbers start to get really dramatically high. Some colleagues, some people on the call might remember back in August we had some challenges in Shepparton where we suddenly had a period where, because a number of cases went around some schools, we had a high number of people who were isolating under the previous Delta protocols, to the point where we started to struggle with supermarket distribution and food on shelves and all the other basic things. So all that contingency planning is now happening across our emergency services, across our food distribution markets, and across our central and regional and local government teams, to work out exactly how will we manage with very high levels of staffing absence because of COVID in the community and close contacts being isolated. One of the measures we're working on at the moment is around alternative arrangements for critical workforces so that they can continue to work even though they may have had some exposure to COVID. And again, it's our old friend, the rapid antigen test, that comes to the fore in terms of using that far more intensely to ensure that people are negative before they go into those critical working environments. So a number of things being explored at the moment. We'll continue to work closely with council leadership around what those levels look like. It'll also get into state relief around the relief provision for those individuals and families and communities that can't access the right support materials while they go through their isolation protocols. Having said all that, and those are really important words. Having said all that, the changes we've made in the last few months and last few weeks to reduce those isolation requirements significantly. So we used to have 14-day isolation periods, we're now down to 7-day isolation periods. We had situations where large households especially could be locked down for weeks on end as COVID rattled through different individuals. Again, that's all been brought down to 7 days. So we're making those isolation protocols much shorter, much easier, I think, to bear for individuals and families, but also, of course, reduces the drain in terms of relief support that's necessary. But there will need to be welfare and relief support. We've geared it up a fair amount in the last 3 months, and we'll have to be ready for pushing it a bit harder over the coming weeks.
Okay, thank you for that. And I think the wave that's coming, as mentioned by Bruce, certainly means we should all be active and ready to go. Councillor or Mayor Wood, welcome. Mayor Wood has asked a question here about the pressure on business as staff are having to isolate from case numbers, and we're seeing that at the hospital as well. A question here, maybe Brett Millington, the CEO of Mildura Regional Development, can help me with this one in terms of, is there going to be any support for businesses struggling to open due to no staff? Brett, have we got any information on that?
Yeah, no, so that's all still, I guess, being considered as part of that broader response that Jerome's been alluding to, and I guess over coming days, the ways that we manage that and the support that will be coming through will also be dependent upon the actual numbers that have been registered and the businesses impacted.
Thanks, Brett. Jerome, another business-related question, or it might be for Bruce. I'm happy for either. Deep cleaning is in workplaces, cafes, etc. If a case has been in the site, is that still required like it was?
Jerome, you're on mute.
Many people would want to mute me for a long time, Brett. Good to see you again. Look, the short answer is yes and no. It's not very helpful. Bruce could probably give a better answer. Look, we do expect retail settings, hospital settings to have a strong, regular cleaning regime in place, which includes good basic hygiene, food hygiene, all those kind of things. That's really important. We're not asking for full shutdown and deep cleans after exposure to a positive case, on the basis that there's a good cleaning regime in place normally. So if that's happening, then I think that's how we'd manage it. Bruce, anything else you want to add to that?
Yeah, no, I completely agree, Jerome. I think I reiterate your points earlier. Staff should be vaccinated in the vast majority of instances. For people that are working with each other, they should be wearing masks, and cleaning should be occurring. And if those things are happening, obviously it makes sense. If someone's concerned, additional cleaning is never going to harm. But we should have in place, or businesses should have in place, those robust controls already. That means really it should just be stepping through a little bit more. Obviously, if there's a particular concern that an owner's got, or it's a particular type of a setting or a particular type of exposure, someone could go above and beyond, and there's certainly going to be no harm to that. But with those controls in place, we can be pretty confident that the risk of transmission is going to be very low.
Great news. Thank you, Bruce. Appreciate that. Jerome or Bruce again. I'll come to you, Jerome. A question around babies and younger children and what can be done to protect them given the vaccination status.
Yeah, look, I mean, can I just say, I really do feel, my kids are a bit older, I really do feel for parents and families with younger children, anything under 12, really, it's such a worrying and anxious time. Bruce can talk to the risks for health of younger children and babies. I won't venture to that territory. But what I would say is that all the individual and family and community measures that we've been talking about for a while now, again, good, mask wearing indoors, isolating, minimizing contact in indoor settings, socializing outside, maintaining social distance applies to young children and babies as much as it does to us as adults. Now, of course, you can't control the movements of a 3-year-old at a family party. I'm not suggesting that, but I think we always, as individuals and as families, need to be quite mindful that we're in a different risk environment now. That there are going to be an increasing number of cases in all of our communities over the weeks ahead, and none of us wants to be there, but that's something we can't hold back. So I would be quite mindful about how much exposure my family has to those crowded indoor settings. There'll be cases where we make a decision it's the right thing for us to do as a family, but there'll be many situations where in the coming weeks we decide not to do that. And I think I would just urge that those basic measures that we as adults can adopt will also protect our children and those around us. Bruce, you could probably speak more intelligently around risks to children and the health implications of COVID for them as far as
I mean, one of the only silver linings here, and Kane might want to chip in as well, but one of the only silver linings to coronavirus full stop has been that for reasons that are yet to be fully understood, there's pretty minimal impacts basically from infection in terms of severity of infection. There's plenty of kids who catch the bug and who've caught Omicron as well specifically, but there's very few instances and almost none in Australia, let alone in Victoria, where severe illness has resulted, where there isn't pre-existing complications such as chronic disease and so forth. So I think the issues that you're highlighting there, Jerome, of basically, at the end of the day, we're moving into a world where pretty much all of us in the next couple of months, about 50% of people may get exposed to Omicron over the next couple of months. It's reasonably plausible that may happen. If you want to minimize your exposure, follow those common sense approaches. Stay outdoors. If you're meeting with people, stay out of crowded settings. Use a mask if you're going there. And if you're concerned about your child being exposed, absolutely. But the reality in terms of health outcomes, consistently so far, what we've seen in the evidence, particularly for Omicron and for this new wave now, is there's no evidence that there is a really significant risk that Omicron or COVID more broadly presents to the vast majority of children and babies. But Kane might be able to talk a bit about the experience here in Mildura particularly as well.
So as a father of a 5-year-old and 3.5-year-old and a 5-month-old, this is particularly relevant to myself as well. And I think it's already been highlighted. It's as much about risk reduction as opposed to 100% elimination, acknowledging that it's unlikely to have severe disease. But common sense things, try and stick outside and do ask yourself, is this something we need to be attending, or is it just something we want to be attending? And can I rationalize that to myself and my family and my circumstances in terms of will we go? We have had some severe illness in young children. We still have a lot of Delta around in town at the moment. And so do be mindful, do be careful, but also surrounding those children who can't be vaccinated by people who are vaccinated also helps build a little bit of a wall to protect them as much as possible. So again, congratulations to the people of town who have such high vaccination rates.
Thank you all for comprehensive, but I think a really well condensed answer there. I really appreciate that. A lot of people will take a lot from that. Some really quick, short, sharp questions because we're going to wrap up at 7:30. Bruce, has anyone got COVID twice?
Unfortunately, there are plenty of examples where people do get COVID twice, and particularly when it comes to Omicron, that's not uncommon. What's really important here is if you've got pre-existing infection, the outcomes tend to be much milder. But more importantly than that, vaccination really severely reduces that. And for many people who do get reinfected, it can be asymptomatic, meaning they don't actually develop any symptoms. They get tested, but it turns out they've been infected, but actually the likelihood of severe infection is significantly lower. Going to Kane's points as well, I think that, and Jerome's points earlier, with this wave as well, the evidence isn't in, but if we look at what's happened in South Africa, and South Africa is a very different place, lots of different things happening, but the wave seems to be a very quickly, like Jerome said, a bushfire effect, very, very rapidly moving. Now, there's very limited evidence here to know that that's conclusively what's going to happen here. But if you're really concerned, I'd say a couple of different things. Exactly Kane's point. You want to keep yourself and others safe? Get vaccinated, number one. 2, apply a bit of reasonable common sense, and particularly it could be for a fairly short period here that we're talking about, a few weeks. So if you are concerned about those exposures, altering your behavior to reduce your risk, not going to the dance floors as long as they remain open, avoiding those crowded settings and so forth is only going to be of benefit for you. And it's a fairly short sprint you may be engaged in now.
Thanks, Bruce. Appreciate that. I don't want to rush, but we are coming to an end. Jerome, a lot of people asking, will the booster be made mandatory?
I think nothing to announce on that at the moment, Terry. I think it is what we're very clear about. It is an absolutely essential public health measure that people get their 3rd doses done. So if people come forward and get it done, then maybe the mandatory thing won't be necessary. But I think there's a lot of focus on making sure it needs to happen. And I think we've seen a phenomenal performance about the 1st and 2nd doses. We just need to repeat that now for the 3rd dose. Yeah, sure. One final one, just a practical point, Bruce. When people get a positive test result come back, why aren't they told what variant it is?
So the testing system is under acute pressure at the moment, and from an outcome perspective, it doesn't actually make any difference. Our primary concern is keeping you safe, getting you onto that COVID positive pathway so that you're safe, and also that you isolate and that your close contacts are quarantined. The public health actions, your personal safety, there's no difference there if it's Delta or if it's Omicron. And the current testing regime, the impost that information has to glean that out is just too high a price relative to getting the numbers through currently. Yep, and everyone's treated the same now, so the rules are the same, irrespective. Positive is positive, and we know to go from there. One final one before I wrap up. Do you need the booster if you've had COVID? Yes. Yes, there you go. That's the shortest and sharpest answer.
Very much.
All three have agreed. Can I thank everyone who's joined on the panel? tonight. We've had almost 1,000 screens log in again to our forum, which is a massive engagement piece, and I thank everybody for that. Some key takeaway points tonight. I think Jerome's point around an isolation plan was the first time I've heard that mentioned in that context, and I think that's really important. We've got vulnerable members in the community, isolated groups. This is one where we should help our neighbours. We should be doing things together as much as possible. What a great initiative for us to take away as a Northern Mallee community and really focus on that. So I think that's point number one. Booster, and the booster program is rolling out through Mildura, and I know it's progressing as well. And from that point of view, access those boosters, clearly so important. We've heard it repeatedly tonight. So booster as soon as possible and as practically as possible. Changes are evolving all the time. Keep yourself abreast of those. I think is really important as well. Some industry learnings tonight, and I know we'll continue to feed them out through Brett and his team, who do a great job. So Jerome, thank you to you for joining us again. To Bruce, thank you for every day. The leadership you give us is impeccable, and I thank you for that. And to Kane Treble, to Brett Millington, to Andy Floyd, who's joined us as well, to the team in the background from Council, Ben, Heath from our team here, and everyone else involved. It's a massive effort to pull this off in 24 hours, and we've done it, and I thank everyone for that. I wish you all keep safe, have a great night, and again, if we need to, we will continue to run these forums to keep our community informed. I say thank you and good night.